There he is. He's here now.
Okay.
Oz.
He left again. Larry, you may have to do the honors.
Okay.
Okay.
Rest in the service at the last second. Good. All right.
Yes.
Welcome
you.
everybody this morning to the meeting of the Science Subcommittee. We have a packed agenda. The agenda.
There he
is. Okay.
Oh, he's on mute, but go ahead, Larry.
We have a packed agenda, and in the interest of time, we'll move right ahead. I guess everybody's on, meetings being streamed, public commenters are ready for comment at the end of the meeting. Everything is a go, it sounds like. So I hand it over to Maria Milan for the first agenda item.
Actually, I'm going to take roll real quick, Larry, and then we will move along. How's that?
That sounds good too. Thank you.
Okay, absolutely. Stewart.
Here.
Deborah Deese.
Here.
Anne-Marie Dulege.
Here.
Leon Fine.
Yes.
Judy Gasson.
Here.
Larry Goldstein.
Here.
David Higgins.
Here.
Steve Julesgaard.
Present.
Jonathan Thomas. Art Torres.
Here.
Christina Vori. We have a quorum. Thank you.
Thank you, Maria. So welcome everybody to the May meeting of the Science Subcommittee. I think Larry's already said a couple of things. Let me just say that this meeting is being held under the open meeting rules of CIRM, and as such, for any action items, there will be opportunity for public comment before there's any vote, and there will be an opportunity for public comment at the end of the meeting. I think that that's the necessary introduction, and we can move immediately to the agenda. And I think we start with the presentation. Is that correct, Maria?
Yes.
Good.
Did Jennifer Maria Bonneville?
Yes, Jennifer's up first.
So I'd like to introduce Jennifer Lewis, Director of Grants Management.
Thank you, Maria. So let me just get my slides up here. Can everyone see this full screen? Okay, great. Good morning, everyone. Today I will be presenting to you the proposed research budget for fiscal year 2021-2022. Here's the agenda for today. I will review the 2021 January through June current research budget, and then we'll present the proposed budget for fiscal year 2021-22 with the major drivers and financial considerations of that proposed budget. So first, before I begin, I wanted to provide a little bit of background on the current research budget period, and because it is a 6-month period. So in the calendar year 2020, the agency, as you all know, is operating in a wind down mode with limited research dollars. And then with the passage of Proposition 14, this board approved a budget in December of 2020 for an allocation of funds to reopen our core programs in discovery, translational, and clinical. And since that time has improved additional concepts in education and the infrastructure pillars. Also, prior to 2021, the research budget has been allocated on a calendar year basis. So as we move forward, in order to align the research budget with our operating administrative budget, along with the state's budget calendar, the research budget will be moving to a fiscal year from July to June. Thus, this research budget from January through June that was approved in December 2020 has been prorated 6 months to the 6-month period from what was originally intended. So here is the allocated research budget for year 1 of Prop 14 funding, which again is a shorter timeline of 6 months from January through June. As you can see, $100 million was allocated to the clinical pillar, $60 million to the translational pillar, and $22 million to discovery for our Quest program. Additionally, over the past 6 months, this board has met frequently and been very busy in improving concepts in our education pillar for our Bridges program, research training, and Spark, along with our infrastructure program for the Alpha Clinic supplement that was approved in May earlier. This total research budget is $356 million for the period of January through June 2021. I wanted to note a couple things. If there is a remaining balance in any of these pillars, this will be reported to the board at an upcoming meeting, and funds will be made available for future research budget allocations. And I also wanted to highlight that due to this shorter budget period and the accelerated pace in which we have restarted our core programs, there are several approved concepts in this January through June budget with open applications and reviews pending that will be coming to the board for approval this upcoming fiscal year and be committed in that fiscal year. Next, I would like to discuss the proposed 2021-2022 fiscal year budget. So before we look at that budget, I wanted to share the major drivers and considerations for this proposal that we will be sharing today. This budget anticipates an increase in reviews and volume of applications for the next 12 months, totaling to 22 reviews. And it includes continued funding of our reoccurring program announcements in the discovery and translational and clinical pillars. It also includes an education budget with funding for a relaunch of the conference grant concept, which for those that aren't familiar, this allows for awards to be made in an existing non-CIRM directed conference or provides an option for a CIRM directed conference through a targeted RFA. In addition, the education budget includes funds for a future training program concept that would come to the Science Subcommittee and the board. We are planning to bring that for an undergraduate program later this year, along with a budget associated with that. And then similarly, a basic research concept is in development for our discovery program that would be brought to the ICOC this fall. And lastly, we do plan to bring a revised 2021-22 budget to the ICOC in December with the strategic plan that would incorporate any new concepts from that plan. So just wanted to keep that in mind as we move forward. This next slide summarizes the financial considerations that support this proposed budget. The clinical budget request is $162 million, which is based on the maximum number of awards funded historically per year and an average award amount. So for our Clin 2 program or the clinical stage projects, the most we've funded in 1 year is 15 awards, which is what is this proposed budget is based on, at an average of $8.9 million per award. For our Clin 1 program or our late stage preclinical projects, the most we funded in 1 year, six awards at an average of $4.8 million, which is what is also based on this $162 million budget request. For the translation budget, we are requesting $52 million based on an average number of awards funded historically per review and an average award amount. For this upcoming year, we are proposing 3 reviews with an average of 4 awards per review for $4.3 million average award amount. The proposed discovery budget is $80 million, which is also based on an average number of awards funded historically per review and an average award amount. For Quest in this DIS2, we are anticipating 2 reviews. The average number of awards we funded historically is 12 awards per review at an average award amount of $1.3 million per award. For 2021-2022, we are projecting a little over that of 15 awards in this proposed budget per review. And this is based on demand in our current discovery round that we've received over the past 6 months. Also in this $80 million discovery budget request, we've included funding in anticipation of a basic research concept that, as I mentioned, is in development and will be brought to the board for consideration later this year. The education budget proposal is $66 million, which includes a restart of the conference grant program, funds allocated of about $1.25 million, which is also based on the maximum number of awards we have funded historically per year and average award amount. And it also includes funds for an undergraduate training program, as I mentioned, that is currently in development that would also come to the board later this year. So here's the current research budget and proposed research budget for 2021-2022. As mentioned, the current budget is $356 million. And I would like to highlight the discovery and education pillars as they have applications currently in progress that, as I mentioned, will be committed in the upcoming fiscal year. And this is not included in the new proposed budget ask for the next fiscal year. The proposed 2021-2022 budget includes $160 million for our clinical program and does not include the ICOC approved allocation for our Cure Sickle Cell initiative of $30 million. And currently we have remaining funds of $17.4 million in that bucket. It also has a proposal of $52 million for our translational program, $80 million for the discovery program, $66 million for education, and $0 currently for the infrastructure program, with a total research budget of $360 million. So at this time, I will pause to allow discussion, but the CIRM team today is requesting that the Science Subcommittee consider this budget proposal for the upcoming fiscal year and advance it to the ICOC. And as I will stop for questions.
Thank you, Jennifer. Oopsie.
Steve?
Yeah, here we go. Sorry, I'm back. Too many devices. Yeah, Steve, I think you had your hand up first.
Yes. So, Jennifer, I appreciate the fact that we're going to revisit this budget at the end of this calendar year. For me, there's, and I realize this is kind of a placeholder budget, so just take my comments in that vein. This is really a historical average-based budget for all three areas, and for discovery and translation, there's no, unlike clinical, which is what's the greatest amount we spent in any one year, it's just the average amount spent over whatever time period is you selected. The other way of budgeting is a projected demand-based budget, which is really looking at the arc of the line over time of budgeted amounts. And also, if you look at slide 6 in what you presented, the first thing says it's increased reviews and volume for the 12-month period to 21 reviews. That suggests to me, if we're going to have increased reviews, we're going to have increased applications, and we're going to spend more money. So using a historical average doesn't necessarily line up well with this notion of an increase in the number of reviews. Anyway, what I'm just saying is when we get to when we get to the end of the year and we're looking at the budget again, I would suggest that we try and figure out, we're increasing the size of the funnel as well, which we'll talk about in the concept plan. We're going to include gene therapy-based products, et cetera. We may find ourselves actually getting a lot more demand for research for dollars than we're projecting right now. So I think this is fine for now, but I would suggest we try and take a stab at a projected demand-based budget, looking at, increase over time and also width of the funnel as it increases with what we're proposing to do. So not a question, just a comment.
Okay, thank you, Steve. Larry, I think you were next.
Okay, I have a suggestion about presentation of these numbers to the board and to the public. The Tran and Clin grants require certain levels of match, and I think it would be helpful to show a projection of how many dollars are leveraged from match, that is raised from the community or private companies or philanthropy or whatever, because that's actually a substantial extension of the funding of these projects and ultimately speaks to the public value of what we do.
Sure. Thank you, Larry. Yeah, we can include that as part of that.
Yeah, thank you. Art, I think you have your hand up next.
Yes, I did. I wanted to associate myself with Steve's remarks in respect to making sure that the next time we look at a projected budget, because I do believe there will be more demand, and the historical averages may not reflect where we need to move given the interests of the board and clearly the interests of the science. Secondly, I just wanted to get I think I just did not hear properly on the sickle cell project that we're doing with NIH. What was the update on that, Jennifer?
So the board allocated 30 million, and currently there's 17.4 million remaining in that allocation, and that allocation remains. So that would be, this clinical budget is in addition to those funds.
So we will fulfill our commitment to the NIH then.
Correct.
Okay, thank you.
Okay, other questions? I don't see any other hands. Maria, do you see any hands?
No other hands.
Okay, so this is an action item. Could we have a motion to approve if someone is so moved?
Move to approve.
Sorry, I don't
It was
think.
Deborah, was
Yes.
Deborah, and I didn't catch the second.
Art.
All right,
Great.
excellent. Any further board discussion? If not, this issue is open for any public comments.
There are no
Great.
public comments that I see.
Okay, excellent. So in that case, Maria, could you call the roll?
Yes. Stewart,
Here, yes.
Deborah Deese,
Yes.
Anne Marie Dulege,
Yes.
Leon Fine,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yeah.
David Higgins,
Yes.
Steve Jules Gard,
Yes.
Jonathan Thomas, Art Torres.
Aye.
Thank you. The motion carries.
Excellent, thank you. So then, Jennifer, did you have additional presentation, or was that it?
That was my presentation for today. I believe Gil is up next.
Is next, correct?
Okay, excellent, thank you. Okay, Gil.
Okay, thank you. So good morning, everyone. I'm going to just share my screen and slide deck. All right, so if you can't see it, let me know. Otherwise, I'll move on. And so what we're doing today is bringing for your consideration some concept changes to our discovery, translational, and clinical concepts. And so the board approved some changes late last year in order to help us relaunch these core programs starting January 1st under Prop 14. And so we did a few edits and changes to make that possible. And so today, what we're bringing are some additional changes that would ensure consistency among these concepts. So we're trying to clean them up a little bit from that perspective, and then remove some unnecessary barriers that still exist in those concepts to applicants. And then later this year, we do expect to bring additional and more comprehensive changes that will align these core programs with the new strategic plan once that is developed. And so I'll review what the global changes to the concepts are, just so that we're all on the same page. So the concepts are also, or copies of those edits are provided to you. So if you want to look at the details, those are available and we can go over. So I'm just going to kind of do a big picture overview right now. So one of the major changes was an addition of a statement on each of these concepts that addresses how the programs provide a unique opportunity to support stages of research that are unlikely to receive timely or sufficient funding from other sources. The idea behind this is to provide an element within the concept that states the uniqueness of the program and as under Prop 71 and under Prop 14 fulfills the goal of providing a funding opportunity where federal funding and other sources of funding cannot. And part of doing this is to also correspondingly remove statements that exist in the eligibility section that would require applicants to demonstrate that they are unlikely to receive timely or sufficient funding from other sources. Having it in the eligibility section has made assessment of this element quite difficult, both for the applicants and for CIRM. And so we think by having the board declare that these funding opportunities are unique in this way, I think we can address that goal without necessarily having that element be present in eligibility. Other changes include broadly including gene therapy projects as in scope for diagnostic device and tool projects. Previously, we had done this for all the therapeutic elements, but now we're expanding that into the diagnostic device and tool projects. And then we are removing an eligibility requirement in some of the concepts that small molecules or biologic proposals must involve a therapeutic candidate that was previously funded by CIRM. This was put in place a couple of years ago as our funds were dwindling and we were trying to preserve the core of our funding, mostly to cell therapy projects. And so given where we are today, we don't think that having this requirement is necessary, and we'd like to reopen it up to anyone, whether or not they have previously had a CIRM-funded candidate. And then in addition, some minor clarifications, adding, for example, regenerative medicine to broadly describe the scope of the CIRM funding. And so just very quickly, let me go over some of the specific changes for each concept. For the Discovery 2 program, which funds discovery awards for identifying a candidate therapeutic or a device, diagnostic, or tool, in this concept, we just really made minor clarifications in the language to better describe the eligibility of gene therapy candidates. We experienced some confusion on the part of applicants, and so we're hoping that this will help clarify some points. For the translational program, which targets projects that are advancing a candidate through translational activities, the changes we're making there are for the project manager percent effort, we're changing the minimum percent effort to 50%, and also doing this actually across CLIN 1 and CLIN 2. So all project managers are going to be at 50% minimum requirement. We're doing the addition of gene therapy to the scope of the diagnostic medical device and tools, which are the TRAN 2, TRAN 3, and TRAN 4 opportunities. So that's TRAN. And then for the clinical program, we are changing the proposed time to an IND filing in the CLIN 1, which is the IND enabling funding opportunity, from 18 to 24 months. And this is based on just now several years experience in supporting these IND enabling projects. And it has become clear that 24 months is a more practical and realistic expectation to get projects to that IND filing. We are also proposing a change in percent effort for the project manager here, as mentioned, to 50% to align them across all those programs. And then we are removing a preference that is stated in the CLIN 2 for rare or pediatric indications that exist exclusively for phase 3 trials. And so that preference is stated to be one that would be given by the grants working group in their review. We thought that maybe at this time, given that we really have not seen many phase 3 trial proposals, but also there doesn't seem to be a particular need to have this preference simply for phase 3s over any others. So we thought that that might be removed so that we can align all the phase 1 through phase 3 trial requirements for the CLIN 2 program. And so the requested action is we're asking the Science Subcommittee to recommend board consideration of these proposed amendments for the concept plans. And so happy to take any questions on this. Thank you.
Thank you, Gil. Actually, like to, let me ask the first question, if you don't mind, which is in removing a lot of the, let's call it gating, you are opening the gates essentially. And I just was wondering if you had any estimate of what that might mean in terms of the flow of applications into CIRM. Thank you.
Right. No, that's a great question. It's hard to say. We know based on speaking to some applicants who would have applied or who intended to apply that this was a barrier, but it was not, that many. I think we may have talked to, 5 to 10 applicants where, they were not able to apply given that requirement. But I think this whole year we're testing the waters in terms of the overall demand. We haven't seen a large increase, since January compared to previous years yet. So I think that is part of the ongoing assessment we're going to need to do.
Thank you. I think Judy, your hand up next.
Thank you. Quick question, Gil. I noticed that you're changing the effort of the project manager, increasing it from 35 to 50 in the TRAN and decreasing it from 75 to 50 in the CLIN. And I just wondered what the rationale was for that.
Yeah, so that's a good question. So that is trying to align it again with the experience from our science officers in leading and helping support these projects. And so we have found on TRAN that the need for a project manager is really important at that stage. Having somebody that can help lead the project at that stage needs more than just a minimum of 35%. So that's why that increased. On the flip side, it's interesting that once a project gets into the clinic, we had a previous requirement of 75%, which many had trouble abiding by, and we also found was just not needed. 50% for, in most cases, seemed to be appropriate.
Thank you.
Thanks, Gil. Other questions from anyone? I don't see any hands.
No.
If not, this is an action item. So if we could get a motion.
I can move. Yeah.
Thank you, Anne-Marie. Is there a second?
Second.
Excellent.
Second.
Thank you. Is that Deborah?
Yes.
That was Deborah. Mhm.
Thank you. Any further discussion by members of the committee? If not, we'll open this up for public comment.
There are no hands raised, Oz.
Okay, excellent. So Maria, then could you call the roll?
Yes. Hold on for 1 second. Okay. Oz Stewart,
Yes.
Deborah Deese,
Yes.
Anne-Marie Dulege,
Yes.
Leon Fine,
Yes.
Judy Gasson,
Yes.
Larry Goldstein,
Yes.
David Higgins,
Yes.
Steve Julesgaard,
Yes.
Jonathan Thomas, Art Torres,
Aye.
Christina Vori. The motion carries.
Excellent. Thank you. So do we have other presentations, Maria?
No, that was the last presentation.
Okay. And then that also is the conclusion of the business of the subcommittee today. Is that correct? Or do we have other
Yes.
discussion items? Okay. Good. In that case, we will open this up then for any public comment on any issues related to this committee's interests, so to speak. Maria, do we have any public comment?
I would just wanted to let anyone know you could press *9 if you were not, if you did not know that's how you could get public comment. It is *9.
Okay. And if we do have public comment, just to remind everybody, that your comments are limited to 3 minutes each.
There is public comment from Paola. If you'd like, let me, you can, if you could unmute yourself.
Hello, thank you. Thank you for the opportunity. My name is Paula Andrea. I'm a mother of a skid baby from Canada, and I just wanted to tell you all that we appreciate all the efforts that you guys are doing for the care of all the ADA skid children around the globe. We really hope that everything that you're doing it's gonna really bring us the hope that we need in terms of the care for children, and hopefully that we're gonna be able to give them a lot to that they can go to live a normal life and a productive life in the future. So thank you for everything and all your efforts that you're doing, because it's really important. I just wanted to say that.
Thank you very much, Paula. That was very good to hear from you, and we certainly appreciate your input. Maria, is there other public comment?
I do not see any other public comment.
Okay, excellent. Maria Milan, was there anything that you wanted to add at all to our meeting today?
No, nothing additional unless the board needs clarification on anything. I just wanted to, Jennifer Lewis had presented the budget proposal. I just wanted to clarify that the averages she was talking about was average per award. And in fact, there was a projection done with the anticipated increase in number of rounds, but the projection included the anticipated number of successful applications per round. So I just wanted to make sure that was clear, but we will make it clearer at the next presentation. Thank you.
Chairman, it's Art.
Thank you.
If I may, I just want to have a shout out to Maria Milan. She really expressed an incredible interaction, as did others on our staff, with Orchard in dealing with this crisis, which God willing, it looks like she has resolved and others have resolved to bring to the table. And it all comes down to saving lives. And I'm so proud to have her as our CEO, because she goes beyond the call of duty. And when someone expresses that commitment, and I'm sure it comes from her background as a pediatric organ transplant surgeon, but nonetheless, we are so fortunate to have her. And thank you again, Maria, for I know what you put up with in trying to get this issue resolved for our patient advocates, for the parents, and ultimately for the children. Thank you.
Hear, hear.
Thank you so
I
much.
second that too. Yeah, great work.
I appreciate that. And one of the things that I wanted to make sure of is that there is a lot of interest in this program. I did want to share that Orchard will be enabling a pre-approval clinical trial at UCLA. That is something that they have made clear and public, so that Don Cohn can carry on this work. And so we have been making, arrangements so that CIRM could facilitate that. If there are any additional questions to that, I'm told that Orchard will be sending an update that will be shared with the patient advocate community and the public, and will be made available on their website today. So thank you so much for the public comment. We definitely keep you at the center of what we do, and are advocating for you, as much as possible, and trying to come up with the best ways to accelerate treatments to patients, regardless of challenges we face ahead of us. And I really do appreciate Senator Torres and all the board members' support. We all do as the team at CIRM. Thank you so much.
Thank you, Maria. I think that is an excellent way to end our meeting today, unless there's other urgent business to consider. If there's nothing else, we'll go ahead and close out the meeting. Thanks to everyone for your time today, and we'll look forward to taking up these issues at the next full meeting of the ICOC.
Thank you, Oz.
Thank you.
Thank you to everybody.
Thanks, everyone. See you in June.
Bye-bye.